Hey everybody, we're back. Brand new Cabral Concept. Can't wait to bring you today's show, which is going to be on low iron anemia, 15 signs that you or a child, because this is very prevalent in children, or even a parent, grandparent may be dealing with this. It can happen to anyone at any age. I'm going to give you the most at-risk groups towards the end, but I want to take you through these 15 signs because you have to keep in mind, we're always talking about underlying root cause factors, right? And here's the issue. In many people, low iron can be the underlying root cause issue for dis-ease in the body, especially these symptoms. Now, low iron can be another factor in the overall equation, not the only underlying root cause, because there could be other issues. But let's keep in mind that sometimes bringing somebody back to health can be as simple as, not always, but it can be as simple as getting more iron into their diet. This includes children as well. Let's take it from the top. I'm going to link all of them up at stephencabral.com/3252. So if you want the full list, head on over there. Of course, it's always free each and every day on the Cabral Concept. Let's dive in. First symptom is fatigue. It is the number one symptom as to why you should look for low iron. Fatigue and weakness. If you are someone that is feeling just always tired, you're just exhausted all the time. Why are you exhausted all the time? Well, let's look for all the different underlying root causes. And one form of anemia, not B12, not low B12, not low copper, one form is low iron. And so next week, again, stay tuned for this show each and every day on the Cabral Concept, brand new show. Next week, I'm going to be giving you the exact levels to test for iron, because right now, unfortunately, your child's pediatrician or your PCP is most likely only running total iron binding capacity, TIBC. That is not even by a landslide the number one lab that you should run. And so next week, I want to bring you exactly what to look for and go deeper so that you can find out once and for all if it is low iron anemia. All right, the first one is fatigue. The second one is pale skin. Again, everybody has different shades of skin color. So all I'm saying for you, if you have lighter skin, if you're looking more pale, or darker skin, if you're looking more pale than your baseline. Now, could you have an infection, a virus, some type of drain, like whatever's draining your body? Yes, could be. But if this is chronic, meaning like it lasts more than a week, okay, this could be low iron causing that pallor, right? That paleness of the skin. All right, so we want to look for that. I look for it all the time in kids, and I look for it in the lips. I look for it in the cheeks. If they just kind of look like pale, like just, it's again, you can see that color just isn't in the face. That's something that we look for. Number 3 is shortness of breath. This is important. If you get winded or exhausted more easily with physical exertion, walking up a couple of flights of stairs, or a child playing sports, look for that. And if that's ongoing, could be a sign of low iron. Number 4 is dizziness or lightheadedness. This could be multiple factors. There's no doubt about that. That's why all of these could be multiple factors. So the way that we help people truly get well is process of elimination. We look at all the variables as to what this could be. Well, low oxygen levels, because remember, iron is helping to oxygenate your red blood cells. And if you're low iron, well, you might not have enough oxygen. So you're feeling lightheaded. You're feeling dizzy. I don't know if this is on my list. I don't think that it is, but sometimes you yawn, right? You're yawning a lot. You're trying to get more oxygen. So dizziness, lightheadedness can be another one. The 5th one is tachycardia, probably better known as just accelerated or faster irregular heart rate. And this is one that you can almost feel like a shot of adrenaline, like why is my heart racing right now? Is it anxiety? What's going on? Well, what the heart is trying to do is to deliver more oxygen at a faster rate. And sometimes that's a little bit of an irregular heartbeat. So important to look at that one as well, especially if you've been diagnosed with tachycardia. All right, well, let's take a look at this. Why, right? Is it low iron? And then we'll go into B12 and copper another day. The 6th one is headaches, unexplained headaches. You might say, well, it's not histamines, it's not food sensitivities, it's not stress, it's not eye tension. Could be low iron. All right. And again, all of these, I shouldn't say all, a lot of these go back to oxygenation, right? Why am I tired? Not enough oxygen. Why do I get winded more easily? Not enough oxygen. Why am I dizzy? Not enough oxygen to the brain, right? Headaches, not enough oxygen, moving. So keep in mind, iron carries with it oxygen, right? So we need that. All right, the next one is cold hands and cold feet, poor circulation. That is a big one. We want to keep an eye on that, making sure that if there are reduced red blood cells from not enough iron, that's not an issue because we can rebuild those with more iron in the diet. Brittle or spoon-shaped nails. I actually have a nail diagnosis show from way back in the day. Why don't I try to link that up for you today? That was a fun show. That was a long time ago from Ayurvedic medicine. So that's at, I'll link them all up at stephencabral.com/3252, but that'll be a good one to get into. So if you're low iron, it can also be low thyroid, which low iron could lead to low thyroid. Nails might be brittle. They might be feeling like thin or even peeling sometimes, or they can develop into a spoon-like shape, which literally means they become a little bit concave. And certainly that is something that we look for in our practice as well. All right, hair loss or hair thinning, again, can be another sign and symptom of hormonal imbalance, thyroid imbalance, high cortisol, etc. But if there is an iron deficiency, there is a weakness in the hair, skin, nails. So we certainly want to be aware of that. All right. And it can low iron as well because impair hair growth, just like not enough collagen can impair it. All right. Restless leg syndrome. Many people in our practice, we've helped with restless leg syndrome. Sometimes it's low magnesium. Sometimes we use Ayurvedic herbs like ashwagandha or a product called Adrenal Soothe, but sometimes it could be low iron. Now, the goal isn't to just supplement with iron if you have any of these. You actually want to see, do you have low iron? Because, just a little caveat, postmenopausal women and men really have no good way of being able to get rid of excess iron. So, and that includes children as well. So it's just women when they get their menstrual cycle for, let's say, a period of about 30 years, they are able to remove iron from the body on a monthly basis. Now, also, they are the most likely, potentially, to become anemic. And those are all big factors to look at. Although I will tell you, I've seen so many so many girls, as well as many older women also get low iron anemia. It's not that it can't happen to men. It can. It's just far less prevalent. And I see it happen to many pregnant women, and that is because the blood supply grows, right? All right. So the next one is cravings for non-food items. We'll call it like pica or pica, as some people explain it or say it. So what this is this is a craving for things like ice or dirt or clay. You'll see sometimes kids eating dirt. Maybe some kids just like the taste of dirt, but for many, it can be trying to get more iron. So this is an important one to look at. And we ask this all the time, are they eating dirt? Or a parent will come in and just say, why is my child always wanting ice, craving ice, or eating things like dirt? So that's a serious thing. This is something we see all the time in our practice. All right. Another one, I did a show on tongue diagnosis. I will link that up here today as well from Ayurvedic medicine. But an inflamed, a swollen, what's called kind of a glossy tongue can be a serious sign of low iron, sometimes accompanied by difficulty swallowing, so trouble swallowing. All right, number 13 of 15. We don't see this one as much, so I just want to let you know this. I have not seen it. We've seen hundreds of thousands of wellness clients in our practice. I've never seen it in younger children or younger adults. Occasionally, very occasionally in older adults. So hemoglobin, and again, this is very rare to see, but it can actually cause chest pain from the reduced oxygen flow. This is more serious. Anytime there's chest pain, I'm not thinking low iron right away. I'm thinking, okay, there might be a blockage in the arteries. For many people, it could be acid reflux or GERD, but we take this, of course, very seriously. But it is a possibility that there is low iron as well. Number 14, we see this with both children and adults. Cognitive impairment or just poor focus. So difficulty just staying focused, staying on target. And again, that when you have low oxygen, you can understand why someone would be very tired and not able to function as well. The last one is this: decreased immune function. Not my first and foremost. If someone's lower in immunity, it's not that's not where my go-to is like, oh, you may have anemia, but certainly I want to be able to rule it out. And so what we look at is this person getting, chronic infections, more than 6 colds or so per year? Not as a child, fairly normal for a child to get 6 to 10 colds per year. pretty normal for an adult to get between 3 and 6. I'm always a little bit cautious on that high end. I think 6 colds a year for an adult is quite high. And I would say 10 for a child is quite high. When they're very young, not a big deal. But once they start to get to like 8 years old, 10 years old, 12 years old, really having more than 6 a year as a child is quite a bit. And I would say more than 3 to 4 as an adult is quite a bit as well. We want to start to look at what's going on with the immune system overall. What is wearing down this individual that they're so susceptible, all the time. And that goes to the entire de-stress protocol: diet, exercise, stress reduction, toxin removal, rest, emotional-based balance, scientifically backed supplement, success mindset. So it goes through the whole gambit as to why someone's immune system may not be functioning like we want it to. All right. So as I said before, kind of alluded to it, who is most susceptible? Young children with low iron stores. It can sometimes happen from birth. We've got premenopausal women who are losing iron and blood each and every month. And then we have some older adults that may not be getting enough protein, may not be getting enough iron in general. Having said that, I did say because of the increased iron demand during pregnancy and blood supply, pregnant women can become anemic. I would say that at least in our practice, from functional anemia, which is starting to get low iron, we see the majority of pregnant women by their 3rd trimester. So we're always adding more iron as we get to, call it 30 weeks or so of pregnancy, for sure. And then who else? Individuals with GI tract disorders, so Crohn's, colitis, any inflammatory bowel-based issues can sometimes, again, we don't supplement with iron in our practice except what comes naturally from food and in like some natural supplements. So like if you're having a nutritional supplement and there's chocolate in it or something like that, or there's some pea in it, you're going to get a little iron. Like that's just from nature. Like that's totally normal. And then you're going to get it from food. You're going to get it from some of your greens. And I have a show on high iron. And if I don't, for some odd reason, I'll do that in 2 more weeks from now. I'll do a show on natural high iron foods. Of course, your organ-based meats like liver and others as well, your red meats, if you choose to eat some red meat. Of course, you want it to be grass-fed, grass-finished. But if I don't have a show on all different types of high iron foods, I'll definitely do that. And that is because also vegans and vegetarians are not going to get a lot of iron from animal-based products, but they can get it from vegan-based products. Some of those, as I talked about before, the green leafies, things like pumpkin seeds and et cetera. We'll talk more about that. And so those are the most susceptible people. And it's also why, though, we want to be careful not to supplement with everyone, because if we supplement iron at a high level for children or we'll just call it like non-menstruating women, it can build up in the blood. And we don't want it to build up in blood because the body doesn't have a great way to get rid of it. And if body doesn't have enough to get rid of an excess, which is a toxicity that we talk about in our practice, then it can also cause free radical damage, oxidative stress, and be really detrimental to the body. So that is why next week I am going to give you your typical blood work that you would run for iron, but then also the cofactors as to what is that should be looked at, that I'll tell you right now. 90% of all pediatrician and doctors do not run these labs, and I'm going to make it easy for you. I'm going to point exactly how to get them run, and then you'll just end the question, right? End the debate. That's why I love lab testing. The ones I'm going to share with you are actually conventional medicine based. They're not at home labs. I hope in the future that they are. But the truth is that all of this is really within your control now. Simple to do, and you can take it into your own, wheelhouse of personal responsibility and not have to say, hey, to your doctor, hey, is it okay if I have this run? Sure, great to do if you have a good relationship with your doctor, but some doctors got to come in for an appointment, got to go over your symptoms, got to do all the things. And it's like, okay, but maybe I could just run a lab test on my own. And I'm going to teach you because I want you to become the health coach in your own home. And if you ever want to go deeper on this and you truly want to learn all the underlying root cause factors as to why we become sick and unwell, head on over to integrativehealthpractitioner.org and we'll teach you step by step exactly how to become the health coach in your home. So, and then of course, develop your own health coaching practice if you'd like to. So those are the top 15 reasons. I'll list them again today at stephencabral.com/3252. And then definitely, every single day there's a new Cabral concept, but stay tuned next week because I'll lay out those labs for you and even different links on where to run them. Hopefully this was helpful. Take care, everybody. Have an amazing day. And of course, do share this show with anyone you believe it could serve. Thanks so much for tuning into today's show. Before you go, don't forget to hit that subscribe button. I want to make sure that you're getting our daily content, not missing out on anything functional medicine, wellness, weight gain, weight loss, anti-aging, living longer, stronger, and all of the most cutting-edge research. And if there's any topics you want to hear, feel free to leave them in the comments below. Take care.